I wish I had done the checking like Sonam Kalra. She really took a lot of time in checking the mics. I think my time starts now. Okay, I'm going to talk about saving newborn lives from dream to reality and miles to go. Are we going to make it? Apologies to Robert Frost for misquoting his beautiful and famous lines, quoted many a times by many famous people. Well, there are a few more quotes. I slept on the benches every day and borrowed money from my friends. Famous lines from famous Bollywood hero. Sachin Tendulkar, the cricket idol. I failed in my 8th standard. Well, iconic figure with his lovely husky voice, something like my voice today because of the bad throat, excuse me, said I was rejected for the job in All India Radio because of my voice. Well, I think all famous people have stories to tell how they question the full stop. And I never thought I have done it, but thanks to you all and TEDx for giving me an opportunity to look back, introspect. Did I question the full stop? And I think I have a story to tell you. When I look back, like every girl, I idolized my father. And my father taught me 2 things. One, that never try to be second best in anything. And second thing, that if you want to really do something, you can do it. I remember my exams, December month, just before the New Year Eve. We would sit down and say, we'll finish our algebra. 12 midnight, he would say, I'll make coffee and we'll have walnut cake. By the way, I have a sweet tooth. We'll study trigonometry till 5 a.m. What a wonderful welcome of New Year. He taught me 3 things. He taught me, number 1, learning for the pleasure of learning without the fear of examination. Number 2, he taught me that the journey to your goal is as important as your goal. And the third thing he taught me, that no goal is unachievable. I lost my dad last year in February. Well, somebody just now asked me, how did you thought about becoming a neonatologist? Well, it was my dad who taught me the first lessons of questioning the full stops. But I will become a neonatologist. There is a story behind that. I wanted to become a doctor. That was my dream from my childhood, which was nurtured by my parents. But I had no clue what a neonatologist is. And by the way, a neonatologist is a physician who looks after the newborn babies. I was in last year of my med school and we have the community posting, and I was here in Kishtwar, a very remote district of Jammu Kashmir, right at the Pakistan border. And you can see the roads over here were almost unreachable. We were working in a small community hospital and patients were brought either declared dead on arrival or they would die soon. And one day the senior doctor called me and he said that you have to go to a nearby village with one of the senior nurses. We had to walk down 10 hilly kilometers. We reached there. There's a beautiful woman on the floor in great pain and agony. She was in the last stage of labor and we had to help her to deliver. And she delivered a beautiful baby boy. But the baby didn't cry. Baby was like a white sheet. I clutched the baby. The baby was warm. I started resuscitating the baby. The art which I had learned during my medical school, giving mouth-to-mouth breathing and doing chest compressions on a tiny chest. But there was a full stop to a life, and with all the potential, I could not stop it. I think that was my motivation. That was my motivation for the purpose in my life, to save newborn babies. Well, I had just started my career as a neonatologist, and one fine day, one of my friends, who was a pediatrician himself, came to the NICU, a newborn ICU, with his tiny baby who was 650 grams. And the obstetrician had thought that this was a dead, aborted fetus and had left in the tray. And he brought the tray along with the placenta, the lifeline, and he told me, Dr. Kler, I think this baby is alive, is breathing. We worked hard with a dedicated team of doctors and nurses, and mind it, this is something like 27 years back, we had very limited infrastructure. Today, he's a young man, 27-year-old, and he's teaching computers to children who are differently abled. When I told Ekant, can I share your story? He said, Auntie, it'll be pleasure. It'll be a proud moment for me because you gave me my life. I think these babies, the challenge of saving these babies, got me into the specialty and do more for these kind of babies. Well, I came back from, after being trained as a neonatologist, and my husband was still in UK. He didn't want to come back to India, like I think somebody else also said. So I came to India with two little boys, the young one 6 months old. I was given a job by Tertiary Care Hospital, Sir Gangaram Hospital, to develop neonatology. Mind it, at that time, there was nothing like neonatology. So I had a tough task of developing a neonatal ICU from nothing, from a scratch, and also having a little bit of opposition from the pediatrician friends, like I was going to take away a pie of their work, the newborns. And I had a home to look after. So developing an NICU and balancing my work of looking after two mischievous boys was like running a marathon race every day. But I think with the support of my family, my husband, a busy cardiologist himself, who always encouraged me to fulfill my dreams, my parents, my mother, who always said that you take care of your work, I'll take care of your home. I think she always saw her own achievement in my work, in my achievement. And a very, very dedicated team of my friends who put in their endless work to build a unit of excellence, a department of excellence. And I will be forgetting my job if I don't talk to you about my best friend, my JKU 405 Maruti 800 car, which was given to my dad when I came back, and every policeman on the beat knew the doctorney from Gangaram Hospital and her car because I was going almost every night to the hospital. So with passage of time, we started saving more and more babies. We were getting better and better, and we were getting referral of more and more sicker babies. What I realized was that the babies who come from outside, they are not transported in a manner that they can reach the hospital in a stable state. Hence, the babies who were coming from outside had much worse outcomes. And even if they survived with more handicap. So I thought that there was a need of having an excellent transport team, a transport system. So we established a transport team, and we started transporting babies in a more stabler condition so that from the point of the reference to the time they come to our NICU, they come in a stable state. And I'll be forgetting my duty if I don't introduce to you one of the first baby I transported from Amritsar. This was a 6-hour old baby who was severely asphyxiated. And at that time, it was a challenge to transport this baby. We saved this baby, and today this boy is 18-year-old, and he wants to become a pilot, and he wants to have a fleet of air ambulances. I think this was a tribute to the baby I lost in Kishtwar. And I think India, with a country where 65% of the population lives in the villages, we need to have strong transportation system so that babies born in the villages, in the community hospitals, at homes, in desert, in hilly areas can be transported in a more stable condition and they can be saved. I think one gets greedy with time, and I felt that for a country like India with 26 million population, we need large number of neonatologists, we need more neonatal units. So I thought that there was a need for a postdoctoral program in neonatology so that we can train more doctors into neonatal medicine and they can take care of more newborn units. So this was in 2000. We started with the help of rest of the academician friends, colleagues. We could start a 3 years postdoctoral program. And right now, there are almost more than 17 institutes which are running a postdoctoral program. And most of the major cities or towns are having newborn units. And these are some of my trained fellows who are working in different places. Well, around the same time, that's year 2000, the world community at the turn of millennium developed Millennium Development Goals, which addressed eradication of hunger and poverty, achieve universal primary education, women empowerment, and apart from that, health for all by 2015. I think this was a very beautiful milestone for making a better world. And the MDG goal 4 addressed the childhood deaths or childhood survival. Well, I don't want to bore IIT students to know about what neonatal mortality rate is and how neonatal mortality rate has behaved from 2000 to 2015. And we've still not achieved the MDG goal. But I want everybody in this hall to focus on this slide, that 27% of the deaths in the world are contributed by India, and it's a shame. If women and babies are not safe in a country, the country cannot be called a developed country. And let me tell you that these close to 0.7 million deaths are highly preventable with some basic quality care. Well, just to show you that newborn mortality is one of the areas in the under 5 child mortality where not much or very slow progress has been done. And the 3 major causes of babies dying are either they are born low birth weight, or they develop sepsis, or they develop asphyxia like the baby I described in the Kishtwar incidents. And that was a change in my destiny. Well, around the same time, I thought that, since most of the deaths are occurring in the rural areas because of poor access of health care to people living in villages or people who are poor. So around that time, I was the secretary of National Neonatal Forum. And here I would like to just introduce NNF. NNF is an organization where people from diversified groups are working. There are people who are pediatricians, child specialists, people who are newborn specialists, people who are public health people, people from industry, people from IT, people from social media also are working for it. And I thought this was the time to get out of my comfort zone of working in the NICU in Gangaram Hospital. And I started going to more remote areas in states, and we started establishing newborn units in the districts. We started training the doctors and the nurses, and with the result that, initially this work was taken only by NNF and UNICEF, but later on, as we started advocating this program to the state governments, to the administrators, to the other institutes, people chipped in. So we made a large network where the states were asking for developing these units in their districts. Many more institutes joined, and today, as we stand, there are something like 400 intensive care units, which are called special care newborn units, SCNUs, which are developed in the districts all over the country. Not only that, with this, the government took heed, and the programs and the policies became more akin or more sensitive towards survival of the newborns. So I think these were the steps which really made me question the full stop at every step, that what next? Just a little bit that if we want to save more newborns, the basic principle is integration of health services. Let me tell you in very simple language that if you are healthy adults, you become healthy parents. If you are healthy parents, you'll have healthy children. So it's the life cycle in which you have to provide integration of the services. So what is important is there are few basic principles if you want to save more and more babies. We have to have equity in the access of health services between the rich and the poor. We have to empower women so that we ensure that they have access to health care and they have resources. And the most important thing is that they are decision makers. And the only way that can be done is by educating women. We need partnerships between the government and the institutions, between the private and the public health services, partnerships between the medical fraternity and technical people. I work with a group of IT students at Stanford who develop cost-effective equipment for newborns in developing countries. Why can't that initiative be taken by the IITs in India? Why Stanford? So I would like more people sitting in this hall to volunteer and say that we want to work. We want quality in the health services and quality at every level, whether we are talking about quality of health services in the community hospitals or in the larger hospital, in the public hospitals or in the private hospitals. And the most important thing is that we need accountability. Unless until there is good governance, there is transparency, we cannot account for each mother or each baby dying in this country. So I would say that it's not just the medical fraternity who's responsible for preventing so many newborn deaths. It's, I think, all of us, each one of us who's sitting in this hall. Well, I continue my journey, questioning the full stop, fighting with these basic principles for newborn survival. I work on equity in providing health services to the most remote rural areas, providing empowerment to women. I'm working for the last 3 years with one of the NGO called Basic Health, which works with the high quality, low cost primary health care, which is provided to the last mile communities in the rural area of Rajasthan. This is a country of disparities. On one side, we have babies dying because of poor access to health care. On the other side, the doctors are over-treating, over-prescribing antibiotics, and we are losing patients, babies, because of multi-drug resistance. So there has to be some quality check. And this is just a news headline from New York Times talking about babies dying because of multi-drug resistance infections in India. So we have to work on certain quality initiative so that the healthcare which is provided is the most optimum. We are not over-treating. We are not over-prescribing antibiotics. So here I work with a quality initiative again partnering with Indian School of Business and with IITR, which is Institute of Health Improvement, on reducing healthcare associated infections in community. I'm sure all of you realize that the pollution is increasing, and we probably don't understand that what are the ill health effects of increasing pollution. So here I'm partnering with the Public Health Foundation of India on studying the ill effects of pollution on the fetus, which are the most vulnerable, the baby which is growing in the womb of the mother. And a moment of glory last year when I was conferred Padmabhushan by the president of the country. I'm glad that this award came 17 days before my dad passed away. This was a great honor, and I'm so happy that it came to me when my father was alive. Here I would just break and just share with you that I was a very introvert, shy, hardworking girl. I was very shy of public speaking, and when I joined PGI Chandigarh, people used to say that it speaks. It is for a non-living person. So that girl, that nice girl from Kashmir. I remember my first presentation, I had some cards in my hand. You know, those days we used to write the presentation on the cards. And I bumped into somebody and those cards fell down and I lost the sequence and I cut a sorry figure. But let me tell you 3 things in the end, that if you have a dream and you want to pursue that dream, and if you have fire in your belly, you can do anything in life. But the most important thing is that whatever you do, you should enjoy it. And I would like to finish with the same lines with which I started. Saving newborn lives, miles to go. We are going to make it. And there is no full stop, never. Believe me. Thank you very much.